Hello, wellbeing buddies, and welcome to this session on dementia. So, we're going to cover what is dementia. We're going to cover how it's assessed. We'll look at some of those associated risks. We'll look at how it's treated. We're going to discuss about advanced decisions because that's really important. We're going to talk about the support that's out there, and we're going to look at how you can help somebody with dementia. So, let's get into this. What is dementia? Now, I've worked in dementia for about 25-ish years, and it's one of the subjects that I'm really passionate about. And there's lots of information, advice, and guidance out there. However, what you really need is a foundation understanding early on so you can prepare the journey and you can move with it. And the more you understand about dementia, the less stressful it is and the better outcomes there are. And what we mean by that is ultimately we know that dementia is a decline in cognitive abilities and memory. And therefore, there is very little chance of that being reversed. However, there are some medications now that are slowing it down, but we'll talk about that in a minute. So let's just get into this. Dementia is a term used to describe the symptoms associated with the decline in cognitive ability. That includes memory, thinking, and communication. And what I want you to imagine is the brain like a fishbowl. And in that fishbowl, you've got lots of fairy lights. And all of those fairy lights are movement, speech, thoughts, memories. And what dementia is, it's those lights being turned off, meaning dementia is unique to each individual. There's no age bracket for this. It's, it is more common in the elderly, obviously, but the youngest person, I think I saw the other day, was about 19 now that's been diagnosed with dementia. So the first thing to remember is this is a unique journey because as we turn off those lights or memory, thinking, communication skills, we're going to lose parts of sequencing. And when we think about it, every job we do, every task that we undertake requires sequencing. So for example, if I was to make a cup of tea, I would need to know that I was thirsty first. So I would run the water, fill the kettle up, boil it, get a cup out, pop the tea bag in, add the milk, add the water, take it out and drink it. With dementia, I may just forget a part of that sequence. And what it means is the task is incomplete. It doesn't mean I can't do it. And it doesn't mean that I lose my ability. I just lose that little bit. So it's about the world adapting to meet that change in needs of the patient with dementia. So bear that in mind. It's not the fact that they can't do tasks, they just lose the sequencing part, and that's really important. So equally, it is a progressive condition that typically affects the elderly, and it is a degeneration of the brain. So when a brain scans, you can see that the brain looks a bit like a cauliflower brain, but it shrinks a little bit. So there are several types of dementia, and it's quite important to understand this because, again, every diagnosis of dementia, every different type of dementia carries different personality traits and different types of behavior. So if you are looking after somebody with dementia, or if you know somebody that's going through the process, it's really important you understand the type because each type will have its own unique challenges and barriers. So for example, most dementia out there is Alzheimer's, and that's the most common type of dementia, and that affects about 70% of the population. Included in that, there are other types of dementia, such as vascular dementia. So that's maybe where there's been a stroke or a block, and depending where that is, would depend on the part of the brain that's been affected. So memory, sensory, communication, if it's at the front, working, executive functioning. If we move through, there's things called Lewy bodies dementia. Again, could be associated with things such as Parkinson's disease and other degenerative conditions. There's frontotemporal dementia, or there's mixed dementia and PICS dementia. So again, mixed dementia is where you have more than one type. So knowing this, ultimately we get an idea about how the person's going to progress and what's going to happen. And mixed dementia is generally one of the more challenging dementias out there because, again, there's a lot going on. So the symptoms of dementia can vary widely, get that out right, depending on the type of the condition. Normally, though, what we're going to see is memory loss, difficulty in language and communication, a change in mood, a change in behavior, and that then results in a change in daily activities. And equally, we can see an increase in aggression and challenging or behavior that becomes challenging and hazardous, not because that's a symptom, but because of the frustration that this brings. You know, you've got somebody who once could do something and now they can't. So that's going to bring its unique challenges. So having that empathy and that sympathy skills support somebody is really important there. So we know that there's no real cure for dementia at the moment, but there are several treatments currently being worked on, and it's all about improving the quality of life for the individual, and some of the medications there help manage the symptoms of dementia. So it helps that mood piece, it can help that memory piece, so it helps the symptoms. It doesn't necessarily help or stop the dementia. So what is dementia? It's a cognitive decline in memory, and it's basically a shrinking of the brain, and ultimately resulting in those sequencing and parts of the brain kind of so the person's not able to do what they could normally do. So how is it assessed? Well, in the UK, we use a combination of clinical assessments and diagnostic tests. So generally what happens is from a GP surgery, you know, we have to do urines and weights and lots of other things for a referral, and they're referred to what's known as a memory clinic. That memory clinic is a specialist service, and in there, it's normally conducted by secondary care. They're going to be assessing the person for this memory decline. So they'll do lots of mini tests. And in those mini tests, they're going to be looking at medical history, physical examinations, and a range of cognitive tests and assessments. This looks at evaluating memory, language, problem-solving skills, and normally cognition as well. There can be some questionnaires, there's mental state examinations, and there is a cognitive assessment as well. So all of that clinical data is put to one side, and then the physical evidence as well. Normally, they would go for some screening. So that's an MRI. Had to think of what it was there, which is the magnetic imaging, or there's a CT scan for a computerized imagery there. And again, that's looking at the brain. And generally what you can see in these is the shrinking of the brain. And what you tend to have is two. You have one before, so you have one, and then you do one in a couple of months' time. And then what you might see is the shrinking or the deterioration there. So with those images and with that assessment, you would then end up with a diagnosis. So once a diagnosis of dementia is made, treatment and management options then are discussed, and they should normally be discussed with the individual, because care should be personal-centered, it should be strength-based, and it should be done with the family, again, to see how the family want to support the care. You'll have a conversation about medication and how to manage the symptoms and the lifestyle changes. Equally there'll be some supportive therapy, and that might be things such as occupational speech, physios, etc. And what you will probably want to do at this point is a referral to your local authorities for what's known as a Care Act assessment. And this Care Act assessment will mean that somebody will come out to the person's home and they will do a review on their activities of daily living. And they will assess them for any reasonable adjustments that can be made to the house. So this may be handrails, equipment, basic stuff to help the person remain as independent as possible for as long as possible in their own home. So that's how dementia is assessed. So now let's talk about some of the risks. So dementia is associated with a with quite a few risks. And when we think about it, it'll make sense in a second. But obviously, there are some common risk factors. So with dementia, the older you get, the more decline or the possible decline there is. So the older we are, the more chances are of getting dementia. But equally, if we're diagnosed with dementia in our younger days, the onset and the progression seems to happen a little bit quicker. There are some issues around genetics. So there are certain genetics and types of dementia which could be hereditary. There are some lifestyle risks here, and that's around activities of daily living. So if you are currently going through the diagnosis, or you've been diagnosed with dementia, or you're having a family member with dementia, it's important to consider things such as food and fluid and going to the toilet and personal care, because ultimately these are skills and things that people forget. So how are we going to maintain that diet? How are we going to maintain fluid so we don't dehydrate and go malnutrition? How are we going to manage self-neglect, so that personal care piece? If they're a smoker, will they remember that they've lit a cigarette? So, and equally with alcohol, obviously alcohol causes a cognitive impairment at the best of times. So if you've got a memory decline, how's that going to work as well? Equally alongside that, there are then some problems around personal hygiene. So if the person with dementia develops memory loss where they forget to lose the signals for incontinence or being doubly incontinent, then we need to think about how we're going to manage incontinence, and that's going to be moisture lesions and pressure care. So how are we going to manage that as well? We need to think about physical health that goes alongside dementia. So normally there's things such as high blood pressure, diabetes, and heart conditions that normally run alongside as a condition with dementia. So just be mindful of those other conditions that link up. Be mindful that people with dementia could be at risk of falls, not because they're clumsy, but because their vision and perception just slightly comes off. And sometimes what you can see with people with dementia is that they grab out, and that's because there's some visual hallucinations, and some of the medication can do that. And sometimes they can look at the ground looks uneven, even though it's not, and therefore they naturally fall over. Equally, thinking about access to the community with this memory loss piece, are they going to remember where they're going? How are they going to get to and from their home? So there's lots of risks here that need to be assessed. And normally your social worker should be assessing those risks with you, but be mindful of them. So again, in homes, what tends to happen is family members tend to have cameras put by maybe the door so people can see people, your mum going or coming or going. There may be sensory mats on the floor. So, if mum's got out of bed at night, they normally wear pendants on their wrists or their chest. So if they fall over, they could push the button and call for help if they need to. So it's important to note that obviously risk factors aren't the same for everybody. And we must live in a condition where we're positive risk taking. But ultimately, we don't want somebody to be at risk of injury, of harm, but we don't want to remove everything where actually we've taken away all quality of life, because at that point, it becomes meaningless. So what's the treatments? As we've already said, there's no real known cures, but there are things that we can do to help. So there is medication that can help slow things down, or help regulate the neurotransmitters in the brain to help that memory piece, or at least mood. Lifestyle changes is going to be inevitable. So it's important that we look at diet, exercise, and social engagement. If we allow somebody to socially withdraw, they're going to decline a lot quicker. So good quality activities, good social interaction stuff is going to keep them active and mindful. And what we need to think about is they're going to regress back, and we'll talk about regression in a minute. But as they regress back, think about the things that they were doing in their younger days. Those are the activities that they're probably going to want to be doing. Equally, think about how you're going to maintain their independence, how you're going to promote communication skills, and how you're going to promote social connections. So again, food, fluid, etc. Think about the caregiver support. So it can be and will get quite significantly stressful and a burden looking after somebody with a decline of dementia. And therefore, it's important that the caregivers have counselling and are educated and understand about what dementia is, how it progresses, and the stages in which you're going to go through. Ultimately, the treatment for dementia should be individualised. It's called a personal-centred care plan, and it should be strength-based approach. So, for example, if Dad used to like gardening, then we can use some gardening activities to help keep him stimulated using his muscles. I was in a care home the other day, and what I saw was this board with chains and locks and stuff, and that's because the gentleman used to work putting locks on doors and stuff. So it allows him to carry on that activity. But what we want to do is we want to move our world into theirs, and the more we go into their mind, the more we go into their world, the better outcomes they're going to have. So, you know, if mum was a hairdresser or dad was a barber in their time, they're the skills in which they're going to remember, and they're going to be the skills that they probably lose the least. So it should all be therapeutic, it should all be personal-centered, and it should all be meaningful activities. And it is definitely going to be a multidisciplinary approach. So the type of people that are involved in treating dementia, you're probably going to have the incontinence care team because they need to do the assessments for bowels and bladder. You'll probably have tissue viability teams because, again, if somebody forgets to walk about, they could be at risk of pressure sores. If somebody's laying in bed for long periods of time, so they need to have a pressure assessment for their bed and chairs, etc. You may have an OT assessment, occupational therapy, and that's around moving and handling and equipments and adaptations. You might need some adjustments to the house. You may need a social worker to make sure all these social activities are going together. They may need a PA, a personal assistant, and that's somebody that they can employ as a direct carer, coming into their home, providing them with the support and care that they need. Or alternatively, you might engage in a care home, and in a domiciliary service. And if that domiciliary services engages, you're going to need to set kind of the things that you want them to be doing and how many activities a day. But part of that treatment then is going to be around advanced decisions. And this is where it gets a bit more tricky. So advanced decisions are known as advanced directives or living wills are legal documents, and they're designed to allow the individual to make decisions about their medical treatment and any care advice or interventions. What we need to understand about dementia is it is progressive. It's going to get worse. So it does become more challenging and more complicated. So the more advanced decisions we can have, the less stressful it is later down the road. And what I'm talking about is it's not uncommon for people in late stages dementia to start refusing washing, to start refusing personal care if they're incontinent. And what we need to be doing now is having these discussions where people have capacity and their memory's good. And we need to say to them, you know, what would you want us to do if you started to refuse personal care? Most people would say, oh God, no, make sure I'm washed. Great, so we'll drop that down. What are we going to do if you refuse? You know, okay, maybe once or twice refuse, but then when do we intervene? Well, okay, so what we might say, look, mum can refuse maybe up to a week, but after a week, I'm definitely going to want to wash it in some way. Then what we're going to have to discuss is then what happens with her behaviour that becomes potentially challenging or hazardous. So what techniques can we do? So what you want to know is if mum becomes challenging, dangerous and hazardous, don't be fobbed up when people go, oh no, we don't do any kind of thing like this. What you want to know is, well, if mum's refusing this or dad's refusing this, what are you going to do to make sure that her dignity is being maintained, that her self-esteem is being maintained, and that she looks like the person that I expect her to be. And that's going to involve some advanced decisions. And there's a piece of legislation that came out in 2020 called the RRN standards, and that's the Restraint Reduction Network standards. And in those standards, we look at how we can support people with cognitive and phenotype, so cognitive declines, and it puts together some steps in which people can take to manage risk. So if I was to start to get agitated or aggressive, you could just pop the back of your hand on my hand, and then that would stop me hitting you, scratching you, punching you. Nobody wants it to happen, but unfortunately, due to the confusion, due to the distress, it is a common side effect. So advanced decisions looks at the way we want to be treated and the way that care should be given. But equally, we need to do what's called the respect form. And the respect form is all about CPR and treatment should somebody decline. Now, advanced decisions and advanced wishes and finances all need to be done through the government. And if you go onto the government website, you will find advanced decision paperwork. And in that advanced decision paperwork, the person it's about will have their wishes and wants done. And the person that's taken accountability for those advanced decisions will also do that. They need to be independently witnessed, and then they're filed. And I think there's like an £85 fee or something like that that you have to pay to have advanced decisions securely done. Once that's done, everybody understands the treatment of the person, the way forward, the way to treat that person, and what to happen in an emergency or serious illness. Now, of course, none of us want to think about end of life, and it's a terrible thing to talk about because everyone panics. But it is something we absolutely must talk about, because part of an advanced decision is making sure that our end of life wishes are understood and done. And what that's called is a good death. And we need to make sure that advanced decisions are understood so people understand how we best make sure that as somebody progresses through the stages, and it can take years, it's not something that happens quickly. This can take years or even up to a decade. You know, I think one of the longest people that I've known is about 27 years. So, but having these agreed and done makes it a whole lot easier, because whilst it's a distressing thing to talk about, it absolutely reduces the burden and the worry towards the end. So advanced decisions are absolutely fundamental when looking at dementia care. So what support is there for family, and what support is there for the person as well? So first of all, it's important to say the NHS has a range of services for people living with dementia, and that's down to the NHS to make sure that somebody is diagnosed and that the treatment is ongoing. There's the Alzheimer Society, and they are a charity, and they will provide information, advice and guidance to family and to others, and they will give you a helpline and all of the support that you need. So everything that we've talked about the Care Act, about additional benefits, about PAs, about home care, and about treatment and advanced decisions. Dementia UK is also a charity, and they're a specialist support group, and they also provide a range of services, including a range of specialist nurses and helplines and resources. So lots of things there to help you as a family member. So that's Dementia UK. Age UK is also a charity who looks after older adults, including people with dementia, and they offer a range of services such as information, advice and guidance, and support groups. There's Care for Carers, or Care UK, and that's a charity for people that look after people, and they make sure that you've got support groups, you've got helplines, you've got information, and you know your rights. So that's Care for Carers, and there's discount cards. And there's a network group, because it's nice to network with other people going through the same thing as you. Then we've got local authorities. Now, your local authority is the one that's meant to provide a range of services. So they're meant to arrange the Care Act assessment. They can then do the things around incontinence assessments, occupational therapy assessments, and all of that stuff. And again, agreeing the amount of hours that somebody needs to look after your relative. So how do you care for somebody with dementia? Well, caring for someone with dementia is challenging, and there are lots of strategies that need to be used to promote the quality of life for both the individual with dementia and the caregiver. So the first thing that we need to think about is the language in which we use. We want to use positive language, because if we use the word suffering, it implies that the person is suffering, and that's not the case at all. You can live well with dementia as it progresses through, as long as the world is moving with you. So we call it living with dementia rather than suffering. So just think about the language. Equally, there is a charity called Dementia Friends, and you can Google this. And Dementia Friends do online training for people that are going through dementia, and there's a little badge that you can get. And if you wear that badge, it basically means that you're trained in a couple of hours worth of dementia training, and that dementia training just gives you enough insight to spot dementia in the community, to offer somebody assistance if you need to, and show a bit of kindness and compassion. So you're changing your language and looking at different things. So we'll talk about that again in a minute. So let's just talk about some of the top tips in caring for somebody. First of all, it is all about routine. Maintain that routine, make sure that they're getting up, medication, personal care and hygiene, food and fluid and activities happens at a regular interval, just to get this routine rolling. Remember, communication is effective. Use simple language. Communication is a scene of sequences. They're dropping some of those sequences. Behind every word is a meaning. So, for example, if somebody's going, if somebody with dementia is going, mum, 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 they're probably saying that they're scared and they want their mum. If somebody is going, dad, 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 they're probably afraid because dad represents this figure of authority and protection. If they're saying, I want to go home, it's because they're scared. So the language in which they use, it's a bit of a code. It's down to us to break that code and to understand what the language is. We need to provide a safe and supportive environment. So that's where occupational comes in, occupational therapy. They assess the environment. Have we got slip mats? Have we got grab rails? Have we made all the adjustments to make the environment safe? Have we looked at hazards on the floor? Have we got lots of clear environments? Nothing for people to trip over. We need to look at engaging in meaningful activities. So whatever that is, hobbies, going out, music. We need to look at positive reinforcement. So lots of praise and encouragement, and try and disencourage any negative language. So don't talk down to somebody, don't blame them. It's not their fault. They can't help it. And I know that you're going to get frustrated, but don't take that frustration out. Take care of yourself as the caregiver. It can be emotionally draining. So make sure you're sleeping well, eating well, and you're taking regular exercise and doing lots of self-care. And make sure that you're going for that support and those support groups. And equally, part of those caregiver support groups is respite as well. So it may be the fact that you need a bit of respite. Remember, caring for somebody with dementia can be challenging and it can be an emotional experience. It takes patience and compassion, being non-judgmental, but it is absolutely possible to improve the quality of life of both the individual with dementia and the caregiver. So I'm going to leave you with this final piece of advice around dementia, and it's called the bookcase. And what the bookcase is, it's an analogy or a metaphor for what dementia is. So if you imagine we've got one bookcase, and it's a flimsy bookcase, and at the bottom of the bookcase, we've got our 0 to 10 years, and they're all of our books, one a year. And then we've got our 10 to 20, 20 to 30, 30 to 40, 40 to 50, 50 to 60, 60 to 70, 70 to 80, 80 to 90. And what happens with dementia, it rocks the bookcase. Now, what books are going to fall first? That's right, the ones at the top. And what that means is those memories are going to drop and they're going to become more forgetful. But as dementia carries on, the bookcase is rocked and more layers of books fall. But eventually, at the lower end of the bookcase, it becomes solid. And that's where it stops. That's where the memories hold. And what we need to think of is that's now the world that that person is living in. So when we think of the world around us, if you go into your kitchen now, the washing machine, the dishwasher, they would never have been there. To somebody with dementia, they're going to look like cupboards. The kettle would have gone on top of the cooker. So there's lots of things to think about when you enter their world. So when we look at them and we think they're doing something strange or odd, they're not at all. They're doing what they think is right in their world. So you can't fight them. Go with it and then change, make change possible. So that's the first thing. Now, over the years, I've had a lot of family members cry and be very upset, and it's quite distressing. And I've had a lot of family members go, what's the point? Why am I coming to see my relative? They don't remember me, and I find it really difficult. So what's the point? And I say to them, well, look, yes, this is the bookcase. They don't remember you now because you're not that child. But if you've got photos of you, you can reinforce those memories through life storybooks and through photos. So just reinforce that through those photos. Then what you can do is remember this. That's the hippocampus, that's their memory going. Then we've got this nice solid bookcase, and this is their emotions. And again, same bookcase coming up. The difference with this bookcase, the emotional part of the brain, when it rocks, the books don't fall out. And what that means is this. You might take your mum out for a nice day. You might go to the seaside. You might buy some fish and chips and an ice cream. And your mum gets in the car and she forgets it all. But what she's remembered is that feeling of love, warmth, and connection. So while she's forgotten the ice cream and the fish and chips and that, what she remembers is that connection of love and feeling safe. So there is always hope, and to remember that is a key thing. So just remember that the more love you show, the more kindness you show, the more they're going to connect with you. But if you lose your temper, if you start to get angry, if you start to show the signs of worry, they're going to pick that up and they're going to connect that negativity with you. So remember, the flimsy bookcase, it all drops. Enter their world and it becomes easy to manage. This emotional piece, it's going to rock, but the feelings are still going to be there. I hope that helps in some way. I hope that the information I've given you has been enough to understand what dementia is. So it's a cognitive condition that declines, how it's assessed through secondary care, memory clinics, through a series of tests and scans, what the risks are, self-neglect, falling over, getting lost, forgetting to eat and drink. How we treat dementia, kindness, compassion, non-judgmental, swap the language, slow it all down, meaningful activities. Looking at those advanced decisions, downloading the paperwork from the Gov website, making sure we've got those advanced decisions, and making sure that we've had those discussions around end of life so we can arrange for a good outcome, so we can live well and we know what's going on, so nobody's going to be distressed at any time. The support, lots of charities, Dementia UK, Alzheimer's UK, AIDS UK, to provide that, and local authorities for the Care Act assessment. And finally, how to treat somebody with dementia, enter their world, try and understand what they're doing in their language, look for those cues, and you will find a much better way of working with somebody with dementia. Anyway, I wish you all the best of luck. And if you want any other information, advice, or guidance, please just drop us a message. Take care. Bye for now.